Thank you for joining. I did want to wish everyone good health and really get started with this interactive session. And just before doing so, a couple of quick points. My name is Anant. I work in Dasra. I do a lot of the work working with NGOs on their journeys of impact. I'm privileged to be joined by Dr. Kumud and really a very, very warm welcome to you, Dr. Rai. And very quickly, Dr. Rai is the founder chairman of Echo Trust. He is really doctor's doctor, if I may. He has served the country for 25 years in the Indian Armed Forces and really had multiple positions and multiple roles, including being awarded the Sena Medal by the President of India during the Kargil War. Currently, ECHO is at the forefront of increasing the knowledge level amongst doctors and other medical practitioners on how to think about COVID, how to deal with it, and as Dr. Rai talks about really busting many of the myths as well. We thought it will be helpful to get started with some of the tactical points first, and really we have structured this into two parts. We wanted to spend the first 30 minutes talking about some of the points that Kumud has seen, which are on everyone's minds, but really will be useful to hear from him in terms of what is the reality. Please do also put your questions on chat, and I'll do my best to try to bring them to Kumud. In the second half an hour, we will spend some time on, while the crisis is very much there, COVID is likely to have tremendous impact on the NGO sector and the impact the NGO sector can do over the next 3 to 5 years. And I will do my best, and this is a fast evolving area, so I pre-apologize for mistakes I make, but on some of the issues which are really going to be on everyone's minds in terms of NGOs over the next 5 years. But with that, if I can bring you in, Kumud, and really ask you to lead with, firstly, what are some of the biggest questions you keep hearing, and what are some of the things NGOs and all of us need to be aware of as the country is navigating through this phase of the pandemic? Thank you.
Thank you, Anant, for those kind words, and a very warm welcome to all the members in this particular session. A pleasure to talk to each one of you. I'll quickly add here that I am a practicing doctor. I serve as Director of Vascular Surgery at one of the private hospitals in Delhi called the Max Hospital. And I have continued to work through the COVID crisis for last 14 months plus, continued to go to the hospital despite being on the wrong side of the age as far as Corona is concerned or COVID is concerned. Additionally, when the second wave came for the last 5 weeks, the demand for medical consultation was so much that I have been doing teleconsulting, and I have personally treated or helped treat about 300 COVID patients. So the experience which I'm talking about today comes not only as a medical practitioner, but as somebody who's continued to work in a COVID hospital or a hospital where COVID patients are being treated, and B, who has personal experience of treating these patients for the last 5 to 6 weeks. The first issue, Anant, and thank you once again for your kind words. The first issue I want to tell everyone is that how is this second wave different? I think we have a very mature audience. We know that while it is the same COVID, it has mutated, and that is part of the reason for the virulence or the severity of the disease this time. Who would have imagined that we would cross over 400,000 cases a day for a few days and have the envious record of having the highest number of deaths in the world, and we overtook US. And this happened in part, of course, because we let our guard down and the social norms were, not adhered to, but also because it is not a new virus, but a mutated virus. And a few other things which are specific this time is that it has affected the younger lot. About 30% of the people are under 25 to 30 years of age, and children have been affected, which didn't happen last year during the first wave. So how it has been different, it has been slightly different. And now we realize, initially we thought, oh, it's a very benign thing, people will not die. But the deaths are so much that it is at least as serious as the first variant or the first few variants which were there with us last year. The second thing is that the rules of therapy keep changing by the ICMR and the government of India. So it can be a bit of a challenge what to do in a fresh COVID case for most of the lay people. And I'll lay a little bit of emphasis on that part. The third question I want to address is that which mask is better? So clearly speaking, N95 mask is better. There's a K95 mask also. The specifications are more or less the same. It is only the Chinese standard, whereas N95 is the US FDA standard. Otherwise, the masks are pretty much similar. There is evidence to suggest that double masking is better. And if you wear two masks, the inner one should be N95 and the outer one can be a simple cloth mask. But masks need to be worn. There is a small group of people, and that theory has done around the circles for a few days, including some doctors. Some of you may have seen the viral video of a Bangalore doctor who was ticked off for not wearing masks in public. I would say that all of us can have a private opinion, including doctors, but I think where an overwhelming evidence is concerned and where national emergencies are concerned, we can be good citizens by adhering to these rules. An important issue which has come is, should masks be worn at home? Now, so far it was not true, but in this particular second wave, evidence has come, or at least when the cases were at the peak, they are all dwindling all over the country, that wearing of masks at home when members were in touch with each other has distinct value. It's difficult to adhere to, but there is some evidence which has surfaced regarding that. One more thing which has happened with this current wave, which didn't happen last time, that COVID has spread to hinterland. It was largely an urban phenomenon during the first wave, but this time it has gone down to small towns, it has gone down to villages, and it has wiped out almost 1/3 or half the population of village. In some cases, you may have read 45 members are dead in a village. So that is also a variation this time. The two other things which we need to do is maintain distancing, and I think social distancing is being used very often, but please maintain distance, try not to go out if it is necessary, whether for shopping or mingling or for whatever, and the use of hand sanitization. The thus surface disinfection help? The short answer is no. In the first wave, we all thought that, cleaning the surfaces, whether it was our cars or our desktops or whatever, helped. But the mode of transmission is not through surfaces. There is now clear evidence to suggest, and FDA has also, not really FDA, the US authorities have changed their guidelines that COVID can get transmitted not only if someone coughs or sneezes close to you, but it can be an airborne transmission. So please be careful. And why I am saying this important is that cross ventilation at home is therefore important. So if the time permits, and if you have a home which can be cross ventilated, please leave the meshed windows open so that the air can circulate, and that has known to reduce the spread of COVID this time. The last thing which I will say quickly in about the general things about this is there is a lot of concern and hype going around the black fungus or mucormycosis. This really is a problem. But we need to know very clearly that in which group of people it happens, who are suspect. It's not that every COVID patient is suspect. It happens primarily in diabetics who are poorly controlled, number one. It usually happens in the more severe form of COVID disease, generally which requires hospitalization or at least have severe symptoms. It happens in people who have taken steroids, and not only taken steroids, but heavy doses of steroids. It happens in people who have had immunomodifying agents like tocilizumab, bit of a tongue twister there, and who have had IV antibiotics. So these are the kind of people we get it. Now, in Delhi today, there are about 160 cases of black fungus. And considering that Delhi has had in the last 6 weeks, anywhere between 5 to 6 lakh cases, you can imagine what is the percentage. And some of them have come from outside of Delhi for treatment. So the incidence, as we call it, or the chances of anyone getting it is very, very low. And I'll talk about steroids a little bit later. If anybody wants to ask any question at this stage, by way of introduction, I have finished, and I'll move on to the next topic of vaccination, but I'll take a pause here. And on these 5 or 6 points, if anybody has a question, we could take a quick couple of questions here.
Great. I see some questions on the vaccines already, Kumud, as you cover that, maybe I'll bring those. I think Shivani has a, go for it, please, Shivani.
Yeah, hi, Shivani here, so thank you. And I have a very quick question that, steroids cannot be used, should not be overused. That is something that we heard just now, and we have also been hearing from other experts. Now, the thing is, when you as a patient are admitted in a hospital, you're so much dependent on what decision your doctor takes for you. So how can you actually avoid overtaking of steroids, because it's actually the doctors who will decide the course of action. So it's just a question which comes to me, so thank you.
No, that's a very good question, Shivani. And I would be limiting my talk today primarily for the outpatient or the home care management of COVID. Obviously, your point is absolutely valid. It is left to the doctor's judgment when to use steroids and how much to use them. And believe you me, steroids work like magic. My own mother-in-law was admitted and she was not doing well, and she was put on steroids, and lo and behold, she walked out after 10 days. And this is not an anecdote. This is the experience across all the intensivists who have treated them. I was trying to say something. The number of people who probably get admitted with COVID disease is just about 5%. And those 5% should trust their doctors, and those who happen to be either in a COVID ward or an ICU ward should leave it to the judgment of the doctor. Your point is absolutely valid. But let me tell you, the inhalational steroids which are used as an aerosol form, as a puff, or better still as a nebulizer, or low-dose steroids which are used in OPD setting, outpatient setting for 5 to 6 days, have not caused this black fungus. It has invariably happened where much high doses were used. If the patients were diabetic, as I said, those 4 or 5 criteria need to be fulfilled. But thank you so very much for your question.
Thank you.
Abhishek, let's go ahead, please.
Yeah, good evening, everybody. Good evening, doctor. So I have a question like, what are the commonly found after effects of the second wave of COVID? And what kind of precaution would you suggest after getting, after recovering from this COVID? So is there some kind of precautions we need to like?
So I think, Abhishek, that's a very good question, and we'll park it towards the end of this discussion, because there is something known as a post-COVID syndrome, or long COVID as it is known as, and what can we do about to mitigate that? That's a difficult problem. But if you permit me, I'll answer this question slightly later. There is a question, is there any data from black fungus cases from rural India? Is it more? Honestly, at this point of time, we don't know the answer. Fungus is all around us, and some of it resides in these are common commensals which reside in our own body. So we needn't worry about it that much. I honestly do not know that there is any hard data. There's surmises that it may be more in the rural area. What about SLE patient? When can they get their vaccinated? We'll come to the vaccine questions later on, but let me, since we have only 30 minutes for it, let me quickly move on to the second piece. And I'm sure there'll be more questions after that second piece, and that is about the vaccination. The first question, answer, or point I want to raise is, which vaccine is better? Now, there has been a lot of hype right from the time when Covaxin was introduced, when it was literally untested, and many states threw away the vaccine or did not have their patients have them, to now people saying that Covaxin is better. I would say both the current vaccine are very good, and so will be the Sputnik as and when it becomes available. Whatever vaccine you are able to get, please take it. There is no difference, or there's little difference. I would say the efficacy in both of them is very similar. What is the ideal time between vaccination? The government of India current policy is that for Covishield, it is between 12 to 16 weeks. For Covaxin, it is still 4 weeks, but it may change as more data comes in. How long after vaccination does one develop immunity? Another vexed question. Not everybody developed it. In our hospital, I was part of a trial when I underwent my vaccination in mid-January this year, and some 350 odd healthcare workers were traced. So the vast majority, they started developing antibodies after 3 weeks, and at the end of the second dose, that means 3 weeks after the second dose, more than 95% of people had antibodies. Now, even with antibodies, please remember, you could develop COVID. So you need to observe, we need to observe all the precautions, even if we have the antibodies, because a new variant comes and which is a mutant, and those antibodies may not work against it. But the thing which is overwhelmingly clear, and I want to tell everybody, that the vaccine is useful because people who have developed COVID after taking both the doses, the disease runs a very mild course, and death is exceeding the. So I'll give you an example of max healthcare workers. Over 15,000 people have been vaccinated, and the chance of somebody getting a second COVID after 2 vaccination is 5%. And similar experiences are being reported from other hospitals like Apollo and Fortis Hospital. Is vaccination safe? Yes, 100%. The risk of thrombosis has been overhyped. Can one get COVID after vaccination? I have already answered it, yes, but it is milder. What is the chance of thrombosis? So I want to tell you that the thrombosis or blood clotting is of 2 types. What led to a worry in the West was a very rare kind of thrombosis which affected the brain and which affected the abdominal organs. And that is why some of the countries temporarily halted the use of Covishield. But the common variant, which affects the legs, is again not very common. The government of India has recently released his data, I think only yesterday, where they said that the incidence of the chances is 0.0165%. That means it's very, very low, which has been reported. Should one stop blood thinners? Initially, we said yes. The current answer is no, because the needle is very thin and you may get a little bit of a blood clot around there, but you don't need to stop. You are not at a risk of increased bleeding if you take a jab in your muscle while you are on blood thinners. So they don't need to be stopped. If one gets COVID between vaccination shots, or even before vaccination, how long does one wait? The Government of India guideline is again very clear. Please wait for at least 3 months before you think of taking, because after COVID, most of the patients, 99% of them would have antibodies which would protect them somewhere between 3 to 6 months. So please wait for that much period of time. Is cross vaccination in case of vaccination shortage? We do not know. I think there is a gross shortage in the country. I think both the firms are working overtime. Newer vaccinations are coming. There is talk of floating global tenders. Please take whatever vaccination you take. And the answer as to how long the effect of vaccination would last, i.e. the antibodies will last, we do not know. It is presumed that it would be something between 6 months to 1 year. So it might be that, like flu shot, some of us may have to take the vaccination once in a year. So I'll pause here. I'm sure there are more vaccinated related questions, and I'll be very happy to take them.
Thanks, Kumud. I think, before we move to now the testing part as well, but there is an interesting question on the effect on children, and we're going to just cover that in the second part, because many of the NGOs work on education, and there is a direct linkage between schools opening or not opening and how, social distancing will play out. So we'll cover a little bit of that as we get into the second part of this discussion. Just one overall point here is, and this is coming through here, which is there a risk of vaccination? Is there, there is this whole conversation sometimes in especially some parts of India about vaccine hesitancy. I would like to pull that question from the mix and bring it here, Kumud, just in terms of, if some of the NGOs are encountering that, and I'm sure they must be, what would be one or two of the things that you would advise them to say or do? And then please move on to a little bit around testing and diagnostics in this first section. Thank you.
Thank you, Anant. Couple of things we can tell them: that vaccination is absolutely safe as far as the death is concerned. There is virtually no reported death. There are, but they were not related to vaccine in the sense that people did die, but they were more due to their medical condition. I have already said that the biggest advantage of the vaccine is that while it does not prevent you from getting COVID, you tend to get a milder attack, and your chances of getting admitted to ICU are very less, and your chance of dying is absolutely infinitesimally small. So this is the best thing we can say. And from an individual protection point of view and from the societal point of view, if we take all the vaccinations, and this is how it has helped in some of the developing countries, whether it was UK, whether it is in Western Europe, and what's happening in US, as the vaccines have been adopted, their numbers have come down. And so much so that some of the nations have dispensed even with masks. So this is what we can tell them. There would probably be a small subgroup who may not agree to that, and that's fair enough. But this is what we can tell them to adopt vaccination and to overcome the hesitancy.
Manish, please go ahead.
Yes, my question is very simple. What are the QT monitoring consideration for the hydrochloroquine and azithromycin used in COVID-19?
So again, the recommendation kept going, and the current recommendation is that for mild cases, we should not use either hydroxychloroquine or azithromycin. Or some of us have used it, including myself in the past, but this is the current recommendation that we should not use them at all. Neither doxycycline, nor hydroxychloroquine, nor azithromycin. And that's the short answer I'd like to give about this, Manish.
Okay, thank you, sir.
There is a question about Remdesivir injection, and let me quickly take it. I was thinking of treatment later on, but this is again not in the purview of this talk. please leave the decision of remdesivir to your doctor. It will invariably be given if a patient is admitted. It should never be given to a domiciliary care patient who is at home. That is the first part. Now, the remdesivir has got an interesting history. It is not on the list of essential medicine, and WHO has said don't use it because the trials which have said have showed no benefit and in terms of mortality, that is death rate. But what was very clearly demonstrated in one of the trials was that the average stay got reduced from 11 to 12 days to 7 days for a patient. The complication rate was same, everything else was same. So some doctors have continued to use it. Remdesivir, please leave it to the judgment of your doctor whether to use that or not. There is a question about Covaxin, again from Shibani, that there are recent issues. Someone having received first dose, but Covaxin shows nil administered. I didn't get that question, Shibani. Can you please understand? In that case, can the patient just go ahead with the second dose? So what do you mean by nil administered? So let me tell you that if a person has taken the first dose of COVID, and I presume it means that it is he or she is not showing antibodies, it does not matter. Please go ahead and take the second dose. And first and second dose are similar. Of course, they would have been manufactured at different points of time. And as I said, the efficacy of both these vaccines is somewhere in the region of about 70 to 80%. There are claims and counterclaims that it would be effective in about 70 to 80% of the patients. Then what if the second dose is delayed than mentioned in the period of the guideline? What is advisable to do then? I would say that for the Covishield, try and get your second dose at the end, or start registering at the end of second dose at the end of 12 weeks. So you have a 4-week window to get it. Regarding COVID, there are supply side issues. Actually, there are supply side issues for both of them. I would say that if it is recommended 4 weeks and if you can still get it by 6 weeks, go ahead and take it. Just do that, and that would work. As a scientist and as a doctor, I think that will work in most instances. Anand, the question about the children, and I seem to have lost it a little bit. That was how do we go around preparing for children in the to be affected in the third wave? Let me quickly say that my views about the third wave is very different. We do not know whether it will come or not, and even if it is going to come, let us not get self in a kind of a fear psychosis or worrisome mode. Oh my God, third wave will come. What will be happen? What will we do? What will we not do? One of the efforts on globally is to reduce the age for vaccination. And you may be aware that for some of the vaccines in US, they have done their trials, brought down the age first from 18 to 16, and now they have brought it down to 12 years. It is likely that this will be brought down further because, as we all know, traditionally vaccines have been administered to children and they have done very well. So people are just being cautious. But one of the answers may well be to inoculate or to vaccinate the children as well for vaccination. I think we are towards the end of our time here. Maybe I've got another 5 minutes. So let me just quickly cover a few other points which I wanted to, Anant, if you permit.
No, absolutely. And there was one question, there's a lot of stigma around, COVID and especially around the COVID patients in some of, as is the case in infectious diseases. What would be a couple of things which might be useful to cut through that stigma, and especially as many of our NGO partners work in communities and quite deeply so, maybe you can cover that as well. Please go ahead.
So that is a tough one. What used to happen in Delhi, and I suppose it was happening in Mumbai and other places, the moment somebody got COVID positive, the state health authorities would come and post a huge notice outside the door of the house and also in the colony, if it was a gated colony or if it was a building that so-and-so is positive. And this kind of was in a way necessary, I understand, because it would advise people to be cautious in their interactions with them, but it did create a stigma. But I think one thing which is this second wave has done, and which is kind of fortunate and unfortunate, that it has taken away the stigma. So many people, virtually every family has been impacted in some way, directly or indirectly, so that has gone away. What we need to do is a few things about the testing part, about the RT-PCR test. That's the best we have. Please try and avoid the CT scans, CT chests, unless they are advised by a doctor. And the best time to do them would be if the oxygen saturation is on the lower side, or if the person is needing a little bit of oxygen supplementation at home, generally at the end of first week. And then you may get a CT score of somewhere between 0 to 25, 0 being no infection and 24 or 25 being the highest level of infection. But please go by your doctor. Sometimes CT chest was required when the epidemic was at its peak. If the RT-PCR test was normal and clinically you felt very strongly that this was COVID disease, the doctor felt it, one would order that, and that would be a valid indication. The last question, which I will come to, is about the support. So how do we support others? How do we support them with remdesivir, tocilizumab, plasma, etc.? I think we just don't do anything. As was pointed out by Shivani, we leave it to the treating hospital. Finding a hospital was a challenge in the beginning, but now with the numbers abating not, and the governments are promising they are opening more hospitals. And finally, I would say that how to remain positive in these difficult COVID times. So there is an acronym, and those of you who are fond of acronyms, I'll just call that out, and it is called SCHEDULES. If you try and remember that, I have a slide, I may pull it on later. S stands for social distancing, and this includes masks and distancing and personal hygiene. C stands for communication. Talk to people. Simple telephonic conversations, whether you could always do a Zoom call or a video conferencing call or a FaceTime or a WhatsApp call, but even a simple telephone call connecting with people, those who are suffering from COVID, would keep their spirits intact. The H stands for habit. Follow a regular routine through the day, whatever your routine is, whether you are getting up at 5 or 6 or 7, get up at a time, do some exercise within the house, eat your breakfast. If you're working from home, work, but have a routine, similar routine every day. That helps a lot. Exercising is very important. Not only it increases the good hormones, it also increases the endorphins, which are great mood elevators. And whether you choose to do yoga or aerobics or simple walking within the house or a treadmill, do some form of exercise. Diet is good. Take a healthy, nutritious diet. There are a lot of diets which have been purported. None of them I'm advocating. Just eat simply well. The U in schedules use for, please use your time well. Use it for constructively, for pursuing some hobbies, for reading books or writing poetry or music or whatever you want to do, and try to be off the social media as much as possible, because that can be bad. L is to limit the screen time, and which is very important. We are using too much of screen time, whether it is on our cell phone, smartphone, or whether it is on television, or whether it is on a computer. Please limit your screen time. E is engage in creative activities. I have talked about some of them: poetry, music, whatever you wish to do. And the last S stands for spirituality. Spirituality, now is the time. Please believe in your God, and even if you don't believe in a God, believe that there's a power above us which helps. Pray, meditate, do yoga, do joint session with your friends and colleagues, and do whatever needs to be done. So I'll stop here. I think it's exactly 30 minutes to the, or maybe 5 minutes over. And Anant, you can take over from here if you want me to answer a few questions, or we can go to the second half, which would be equally important for all our colleagues who are there, because these have some genuine questions which will help them in their NGO work.
Yeah, no, thank you, Dr. Kumud. And I think we'll circulate the schedule's full form, because I think that's quite, it's quite refreshing to hear things which are not necessarily allopathic from medical practitioners. So thank you for that. As we get into the second part, I'd like to get your views and request you to start with, as now the vaccination is going to, build momentum, and many of our NGO partners are working in communities. Obviously, they're helping mobilize some of the vaccination drives. What would be a few things to keep in mind? Obviously, as more vaccines make their way, and also as you think about that and share your thoughts, are there any best practices or things to again keep in mind around critical response? Because again, many of our NGO partners are in the communities and are in a position to be able to either communicate messages to first-line responders or sometimes even the community themselves. So one, around the vaccination drives, and secondly, around critical response. Any thoughts, any advice? You're on mute, Dr.
My apologies for that. And I think those are some of great questions, Anant. The first thing I would say is that if we can help in any way which we can by sending out the message that vaccination is useful, whether it's by designing posters, if it's rural areas, putting those posters out in community, and in more urban areas, it can be, the message can go out through the social media and other things, that it is a useful thing, all said and done, and it's very useful. Give the evidence, give the stats, which the government keeps on giving. So many million people have been vaccinated, and that there has been no direct vaccine related deaths. So please adopt it for this measure alone. The drives are the way forward. Going ahead, I think it will be necessary, and it was not allowed till now, but I'm sure it is going to come very quickly, where drives will be held in communities, in towns, I would say, in mohallas or in colonies, in schools, in people at workplaces, where they will come and they will give. That would definitely increase, because for an average person to take half a day off work just to get vaccinated, or a day off of work, is not the easiest thing to do. So vaccination drives would be very essential, but we need to wait for availability of more vaccination for that. I think supply and distribution is more of a logistic problem, which is faced at the moment by the government of India and the private hospitals who are procuring them. As and when the vaccines are available, we can address, but the role of NGOs is very much there in maintaining the cold chain and in supporting, in ensuring one could adopt an area, a town, or a small a portion of the town, a village, an area in a large city, and say that we will ensure that 90% of people here will get vaccinated. And starting from procuring the vaccination, getting the people motivated, getting the doctors to go home, or the vaccinators to go home and getting it done, that will be a great idea. What kind of resources are required at this stage is difficult to project, but given the huge size of our country, I think we will need all hands on deck. And those of us who are working in this particular field of in the social sector, it will be a great thing to do to support the vaccination drive. It is perhaps the biggest sort of return of our investment. If we invest into good vaccination, it is a good return for long term and for medium term for the entire nation. So please do remember that.
Oh, thank you, Dr. Kumud. I'd love to bring a slightly different perspective, and I'd love to get our views, and audience, please react. As of course, right now the crisis is playing out, there is the immediate impact, and Kumud spoke about vaccination, and many of the NGOs will play a very huge role in enabling vaccination and reducing vax hesitancy. But this will also have a big impact now in the future. For example, as schools are shut, and there is a high likelihood that schools will remain shut for some time, inequities will increase because schools are a great leveler, and once everyone comes in the school, whether it's a girl, whether it's a boy, there's an ability to access education. Similarly, I'm hearing, and I'd love to get Kumud, your views, diseases which are the non-COVID diseases, whether it's oncology, whether it's tuberculosis. Obviously, as medical practitioners and systems are so inundated by COVID, sometimes patients might even be afraid to go to a hospital for some of the other issues and might postpone it, or sometimes even take it a little less seriously. And finally, around livelihoods, as obviously livelihoods start getting affected because people are not able to go to work, there might be impact again in the longer term. Question to you, Kumud, is as some of this play out, what would be a couple of the things for NGO leaders to do to firstly stay safe, keep their organization safe, and also then start thinking about some of these longer term things, and very specifically, what time horizon should an organization plan for? And the reason I ask is, if it was 3 months and things are going to go back to normal, it's fine, it's a storm one can weather. But if it's 3 years, then frankly, one will have to change one's impact model itself, especially because our NGOs work on inequities. Love to get your medical opinion, Kumud.
So Anant, these are some very interesting, and some of these questions are very difficult, and I would request you to add your own views at the end to this. So it has created havoc. COVID has created havoc in everyone's lives, and let me limit ourselves. So what can we do as institutions? So clearly those institutions which can allow work from home should do that, and this is what ECHO has done, and probably that's what Dasra has done. Even one could think of giving time off to colleagues. And let me tell you what we have done during this time, and about 20% of our people did get affected, or their families get affected. We have just said that if you can't do, there is no question of any leave without pay, this, that. You can't come. Please devote time to yourself and your family. And we trust that all our associates are nobody's going to misuse that, and it has never happened. Giving people off time for work, and I would like you to talk about it, that since Dasra has actually done it. But coming down to the more difficult question of the larger of impact what COVID is going to have, I think at some point of time, we have to think of schools and colleges getting open again. There is no way that this society will be able to survive in a meaningful manner, let's say for 3 years, if schools were closed. I mean, this would bring complete havoc, not only to the children, the impressionable minds, but to everybody else. And the best way of this, according to me, would happen is vaccination. It has been estimated it will take between 2 to 3 years for our entire population of India to get vaccinated, at least the eligible population. But that would be one thing. But I think at some point, authorities will have to take a call. Honestly, I thought the way COVID numbers came down from December onwards, I thought the schools would be opened. And to be fair, the Delhi government had opened its schools, at least the government schools in Delhi, and they were allowing. So I think a similar thing would happen because, as you said, school education is a great leveler, and that would help. But may I request you to talk about what Dasra did and how it gave some time off, and some of the NGOs can take a lesson or a leaf out of that and plan things.
No, absolutely. And I think many NGOs are already doing it, but I think the one thing was almost taking a two weeks caring leave, and it was done like Kumud said, without any questions asked, because the organization needed a break. And more importantly, I think people were getting affected in their close surroundings, and mental health was taking a big toll. Needless to say, in true style of Dasra or ECHO, people came back and started itching for action even before the 2 weeks were done, but being very conscious and giving this. And I believe personally, we'll have to do this every 6 months because it's a long haul, it's a marathon. So I think this is something for maybe NGOs to think about and consider. And I think the other thing, just to, and I'd love questions and audience to come in. Anything to do with livelihood, especially informal workers, small scale industries will get into trouble, simply put, because it's one of those things where supply chains will get disrupted, and India relies on informal workers and India relies on small scale industries. So that is one chunk which is going to have a long-term impact. Schools, Kumud spoke about, we need schools back, but there is a reality that if any child dies, it will be almost impossible politically to keep that school open. So the reality is then NGOs have to think of how to get phones into the hands of the girls, how to make sure online education doesn't become inequitable education. And of course, finally, for non-COVID diseases, what is the mechanism that patients are able to get treatment and get help? On the last point, and I'd love for audience to come in, but on the last point, Kumud, any advice? Because, again, I can only comment anecdotally, but, it seems like people are afraid to go to hospitals for things which are non-COVID related. And again, I completely understand, but what would be your advice on very real issues that people might be facing, especially for older generations or for communities? Yeah.
So Anant, that has really happened. What you have said, that people have got worried, and rightly so, and some of them have got scared and stopped coming to the hospital. I would suggest that let them have online consultation with their specialist doctors on a regular basis. And these are people, so-called stable patients on things like in the fields of cardiology and the like. There are a couple of areas where it does not work, and we all know, like, for example, patients on dialysis. For them, it's a lifeline. So they have to go for their hemodialysis twice or thrice a week, whichever they are doing. And I would say that most hospitals have somehow managed to keep it open, including in the hospital where I work. So that dialysis has not suffered. The other area is also oncology or cancer care, where again, it is very important. If a person has to undergo a surgery, I think that surgery should be scheduled, because if that is the part of the disease, so be it, and that needs to be done. Similarly, if the patient is on chemotherapy, he or she should not disrupt his chemotherapy cycles and go there. It did get disrupted, but the good thing is in the 5 or 6 weeks, this second wave is abating. The Delhi figures today are very encouraging, 3,500. And to think 4 weeks ago, we were at 28,000 consistently. I mean, we used to think that Mumbai is a bigger problem, but Mumbai won much before Delhi. And I'm very, very share that very openly, that Mumbai model or whatever they have done was very good. But coming back, all these things took a backseat because of this huge surge. And now would be time to bring back equity to these patients. And the third would, of course, be serious cardiac conditions like patients requiring pacemaker or bypass surgery or angioplasty. While it has happened, the fact of the matter is, I'll give you, our hospital has a very strong cardiology department, and there used to be somewhere between 70 to 90 cardiology patients in the hospital, and in COVID times, there are 7. Now, it's not that the other people are not having problems, but they're not getting access, and the hospital does not have beds, because 60% of our beds are COVID beds as mandated by the government. So there were no beds, and the administrators and the specialists themselves were trying to prioritize that who needs to get it and who not. But the good thing is, once it comes under control, these issues will come to light. And I think a larger segment of the society, which would include not only the health administrators, but government people, hospital administrators, would have to sit together, and of course, lay public, and to give suggestions that how this equity should be maintained, more so once the COVID starts abating, which is already happening now, at least in the bigger cities.
Oh, wonderful. That's an encouraging message. Just in summary, and I request you to, if you can see that slide with schedules and, on the screen, if that's possible. And while you do that, I think a few messages from the second part of this, which is the vaccination drives, destigmatization, and countering through any mechanism possible. Hesitancy is one obvious thing that NGO partners can drive, I think equity will take a huge hit, especially in the aftermath of COVID. And like Kumud said, all of us have to think of how to reinvent ourselves to focus on that, because it's a marathon. It's going to be a long haul. And finally, the role of NGO partners in promoting mental health, especially for their own organizations, and not just one time, but continuously, will be important. Because as they say, if we don't have if we are not healthy ourselves, how do we serve others? But with that, if I can request Kumud, you to end on schedules and really the one thing which struck me around schedules is lot of focus on staying positive and being careful about all the noise going on in the system, including all the negative noise going on in the system. We will send across some of the notes from today to everyone who joined. Please circulate it, forward it. But most importantly, stay safe, stay positive, and thank you so much for joining. It has been a pleasure, Kumud, to interact with you, and thank you for sharing your insights with our NGO friends today.
I hope the slide has been visible, Anant. I had put it up on my screen. I hope everybody can see that. And I think that's very, very, Anant has said, and I cannot believe it. There is so much of bad messages going on, especially in WhatsApp. And if we are using any other, we need to put a stop. I have stopped, never forwarded any negative messages. Yes, something which is important can be said in the same manner, but so much of negativity and fear and psychosis which is being created, we should be off that. Send positive vibes, stay positive, and humankind has always won against all pandemics. Please remember that. With that faith, with the spirit that we will fight it to the best of our ability, we will do everything, but we will stay positive, and we will not the fear, the grief, the worries overwhelm us. And the specific activities, some of them I have listed here, and I would only say I'm personally a big believer of this. I've worked with many of my colleagues, friends, and patients, and my thanks to Dr. Asif, who's himself a psychiatrist, who has created this slide, and it is his permission that I have used it. So thank you very much to everyone for listening today. Thank you.
Thank you. Take care.
Thank you. Thank you, sir.
Thank you, everyone.
Thank you.